Swedish Hospital was established in 1910 by Dr. Nils Johansson and his fellows with the dream of providing Seattle with a first-class non-profit hospital. Now, Swedish is the largest non-profit healthcare provider in the greater Seattle area, with 5 hospital campuses at First Hill, Cherry Hill, Issaquah, Ballard, and Edmonds, and also has access to a network of more than 170 primary care and specialty clinics throughout the greater Puget Sound area. As a nonprofit medical facility, Swedish Hospital has the mission of improving the health and well-being of each person that we serve while demonstrating the highest quality, best value healthcare to all who we serve. Our dedication to our patients and the health of our region is shown in our most used services, which include our Cancer Institute, Heart and Vascular Institute, Neuroscience Institute, and Orthopedic Institute. In 2016, we hosted more than 2 million general patient visits and over 49,000 surgeries. We take our responsibility of providing access to the services, expertise, and facilities needed by our communities very seriously. We have a diverse patients population around the Seattle area, so to create an inclusive cultural environment for our patients, we have established a multicultural and international program to provide culturally responsive health navigation services.
Our cultural responsive care program here at Swedish was established to better serve the needs of the multicultural community here in the Seattle Puget Sound region. Our multicultural health navigators are dedicated and committed to serving the needs of our patients and families.
We work closely with other internal and external partners in order to assist patients on many different areas, like patient care, billing questions, or simply just basic understanding of how the healthcare system in the U.S. works.
We also help the patient to understand what they need to do to prepare for their medical visit, schedule an appointment, and interpreter who speak their language, understand their document that they receive from the clinic, follow up with the patient important healthcare appointment, and also answer general questions about the insurance and billing issue.
As a cross-cultural patient engagement specialist, I recognize the term multicultural engagement as an extension of patient-centered care. We go out to the community and guide them to the entrance to the care. Our efforts in patient engagement include coordinating health workshops in communities, create and/or deliver translated infographics about preventive care information using SNS, TV interviews, newspaper, and/or columns.
There are many resources that we here at Swedish have available. There are extensive translation services, and that can be in person or it could be through a computerized service. And we're usually able to exchange our ideas and information pretty well utilizing a translator.
The important thing is to listen carefully and to try to get from the patient what their concerns are about what I'm bringing to them, about what the diagnosis and what I'm offering as treatment, and trying to understand what is it they think they're hearing from me. And sometimes we find out that we're understanding 2 different things. I'm saying one thing, they're thinking I'm saying something else, and to slow down and really try to ask what the concerns are so that we can accommodate that.
For me, because I speak Chinese, so I see a lot of patients from China where they have different healthcare systems and practice healthcare differently. So the challenge is the expectation, patient's expectation. Oftentimes people, when they come for physical exam, they expect chest x-ray, ultrasound, sometimes CT scan, the whole body CT scan. So a lot of education on my part to let them know what is necessary and what is not necessary.
We work with our partners and patients directly to educate them on how to choose the right services that they need. We connect patients with our providers and caregivers in order for them to receive the care that they look for.